Hi, I'm Dr. Markhan. I am done with my internal medicine residency, and the tell me about yourself question is a common opening question in many job interviews, including residency, medical, or any residency interviews. So the interviewer asks this question to get a sense of who you are as a person and to hear about your background. They also want to know about a little bit more about your experiences, your achievements. So this is an opportunity for you to make a positive impression and set the tone right for the rest of the interview. I'm going to be giving you a sample answer as well as the do's and don'ts for this question. And what is the philosophy behind this question? I'm going to also mention that in this video. So make sure you watch all of this video so you actually know clearly what you want to have for your own answer. And just keep this in mind, this is just a sample. Don't copy it word for word, and this is just to give you an idea. This is not about, regurgitating your CV. They already have that. Listen to my basic answer, but I actually want you to throw in something very, very personal, something you are very passionate about, or a hobby, anything, but it has to be away from medicine. And as usual, don't make it sound robotic. Practice it enough that you sound natural and not memorized, whether you are going into the interview in person or you are doing it remotely. Sure, thanks for asking. And I know this is a very common question. My name is David Kuhn, but my friends call me Dave, and I'm a recent graduate of 𝐓𝐨𝐲 Medical School. And throughout my medical education, I developed a keen interest in internal medicine over the years. Needless to say, I was particularly drawn to the complexity and the challenges managing chronic diseases. But you can see all of this in my CV, of course. And in addition to my clinical and research experiences, I've also been involved in various leadership roles during my time in medical school. I served as the president of our medical student association, where I organized community health fairs. I also collaborated with local clinics to provide free health screenings, and I also looked to facilitate educational workshops for underprivileged communities. I believe that was one of the things that I'm surely proud of over the past couple of years. And I do believe these experiences have strengthened my, communication, teamwork, leadership skills, which I believe are essential for delivering quality patient care. I'm also actually very fond of a few hobbies that I have. I'm a bit of an artist since my early school days, and I have a whole sketchbooks filled with designs of action figures and movie characters. You name it, Bruce Willis, Street Fighter characters, I've drawn all of that out. But the one thing for myself that I believe that I have different from so many others is the numerous models that I've made over the years using just toothpicks. I have made models of ships, of houses, airplanes. They're about this big, and I would of course love to show you that one day, and it definitely brings a smile to my face, as you're probably seeing right now. But anyways, overall, my passion for internal medicine, coupled with my clinical experiences, my research background, my commitment to community services, this has all prepared me, I believe, to be an excellent resident for internal medicine. I'm eager to further develop my skills and contribute to healthcare in a team setting, and of course, I look to provide compassionate, evidence-based care for a diverse patient population. Thanks for asking this question. So what do you think? I think that was something I just put together quickly, remembering my previous, interview sessions. But in any case, when answering this question, it's important to, strike a balance between providing relevant information and keeping it concise. And I'm going to mention out a few tips for you right now. Number one will be keep it focused. Highlight experiences, skills, qualities that, directly could also relate with your field that you're going into. Showcase your suitability for a residency program and as a person who can work in a group. Number two would be show passion. Express your genuine interest in what you look to pursue or the things you are involved in. Show your passion. Then again, highlight a few relevant experiences that I mentioned about the community service, anything you've done. People have been involved in blood bank monitoring or raising funds for something, some welfare work or an NGO, or somebody who passed away, or somebody's family needs some monetary help. Then do talk about that. That is a part of yourself. Then of course you have to be concise. Keep your answer to within a few minutes. Practice your response beforehand to ensure that you do cover all the key topics. And of course, avoid rambling on. Avoid that. Now let's discuss a little bit of the philosophy behind this question and what might be in the mind of the interviewer. Now that is very important. You need to understand the question before you actually answer it. Number one, they're looking to assess your communication skills. The interviewer wants to evaluate your ability to articulate your thoughts clearly and concisely. They want to see how effectively you can present yourself. Of course, that is an important skill for any physician who needs to communicate with patients, to colleagues, and all the other healthcare professionals. And when you are on the medical floor, you're talking to about 20 people in 1 minute. Trust me, you are talking to 20 people in a minute. So keep that in mind. Then they're evaluating a bit of self-awareness in you. So this question also gives the interviewer insight into your self-awareness and how well you understand your strengths, your experiences, your goals. They want to assess if your aspirations align with their program and you have a realistic understanding of your own abilities, right? And then, of course, they're looking to determine a fit. They're looking to see if you can fit into their culture. And by learning a little bit about your background, your experiences, your interest, the interviewer can assess if you would be a good fit for the residency program. And they're looking for candidates who will align with the program's goals, values, and the population that you're going to be serving. And one thing that comes to mind is that somebody told me back in the day that the program director wants to get you in the residency if they feel that if you're stuck in an elevator, for 30 minutes, you will have a good conversation. They want to talk to somebody like that. Ideally, in the most ideal circumstance. Now let's discuss some answers to avoid and things you should never say. Number 1, avoid irrelevant personal information. For example, you slipped and fell on a banana peel and just hurt your butt and then walked away. I mean, that's irrelevant information. So don't talk about anything like that. And then rambling, have a structure, have a bit of a structure, have an opening, a middle, and an end. You can replay this video and just see what I did with it. And it's important to, organize your thoughts and present in a clear and a concise response and avoid rambling off target. Then number 3 is going to be negative comments about, your past experiences. You want to sound as a positive person. Stay positive, avoid criticizing past experiences or individuals. Focus on highlighting the positive aspects of your journey. Then number 4 is don't be underprepared. Lack of preparation is a problem. And I saw that a lot in the COVID years where people weren't really serious because they were not spending huge amounts of hundreds of dollars traveling to a location for the interview, and they were laid back and they had nothing prepared. And when I was guiding people going through the interview preparation, it was painful to see how mediocre were the responses. So be casual, be yourself, but be prepared. So don't give a generic or unprepared response. Take time to practice your answer and tailor it to your specific residency program that you are interviewing with. So keep all of this in mind, not for just this answer, but for all the answers that you are going to be providing. And remember, I just did this right now for you guys. So prepare something, right? So remember, tell me about yourself questions. This is basically an opportunity to make a strong first impression and set the stage for a successful interview. Use it to highlight your relevant experiences and convey your passion for internal medicine and demonstrate your fit for this residency program. All right, thank you so much. I'm Dr. Umar Khan. You can check out this video that's going to have another interview question right over here. You don't want to miss. And I will also have a link in the description for 25 most common questions and their basic template answers that you can use for yourself. You can check out that link in the description below. Thank you so much.